All right, welcome everyone. We have with us today Raghu Janapur, who is going to talk to us about the COVID-19 and in vitro diagnostics work with St. Cloud State University. The COVID-19 global pandemic has highlighted the criticality of in vitro diagnostics in testing and diagnosing people with SARS-CoV-2 infections. IVD is an exciting space for STEM majors with cutting edge technologies and it is an attractive job market for science and engineering graduates. St. Cloud State University offers courses in basics and advanced IVDs and is taught by adjunct faculty with deep experience in this space. Raghu is Vice President of Regulatory Affairs and formerly the Vice President of Quality at the Healthcare Division at Ecolab. Welcome. We are glad to have you with us today.
Thank you, Katie. Hello, everyone. I'm excited to be here. I'm excited to talk to you about the space of in vitro diagnostics, so-called IVDs. The whole IVD space has gotten a lot of attention with the whole COVID-19 pandemic that started beginning of last year. And I hope this presentation piques your interest into looking more into the space, understanding what it is, and perhaps pursuing a career in IVDs. So with that, I'm gonna walk you through a few slides here. So as I was talking about the whole COVID-19 thing, the strange thing about this disease was the fact that there are people who are completely asymptomatic, have no clinical presentation of symptoms, would be positive for COVID-19. And so last year, a number of companies came out with these tests. And right now there are about 30 plus tests that have been authorized by the Food and Drug Administration, to detect and diagnose people who have this disease. So again, this is against the backdrop of COVID-19. But of course, IVDs was not invented last year. It's been around for about 40 plus years, and it's a really wonderful space to get into. So, but before we get deeper into this, so let's first understand what diagnosis means and diagnostics means. So with that. So diagnosis. So if you look at what the definition of diagnosis is, it's simple. It's understanding what the nature of a cause or disease is. So if you're a doctor, if you're a physician, you need to first diagnose what the issue is before you treat the patient, right? So that's the whole idea of diagnosis and clinical diagnosis. And so in the world of diagnostics, there are two types of diagnostics that you can do. One is called in vivo, which means to say it is in the living organism, or in vitro, which is outside the living organism, or let's say in the case of a human, it's a human body. So in vivo could be something like you do a biopsy and go get a tissue sample. That would be an in vivo diagnostic. Versus an in vitro diagnostic would be something that is outside. So for example, you can draw blood, you can do nasal swabs, you can do a test on saliva, stools, etc. So those are the types of things that you can do with in vitro diagnostics. So in vitro means outside, in vivo means inside. So that's the simple way to think about it. And so, this just gives you, what the whole landscape of IVDs looks like. So the global market size for IVD, market is about 80 billion as of 2020, and with a forecasted growth rate of about 4%. So huge market out there for different types of diagnostics that you can do. So such as clinical chemistry. So you want to know more about, sodium, potassium, etc. Diabetes, to test for diabetes, that's an application. Immunochemistry would be things like, well, if you want to know if someone is having a heart attack, you can do a test for that. Molecular diagnostics is about all these pathogens, all these viruses, bacteria, and things like that. Hematology is all about blood. I need to know more about WBC count, white blood cell count, red blood cell counts, etc. So that would be the hematology thing. And sequencing. So sequencing, I want to sequence the virus. I want to sequence the human genome, for example. That would be a technology. This would be the technology of IVDs. And what you see on the screen here are all the leading companies that are out there: the Abbotts, the Beckmans, the Roches, etc., etc. So a number of very leading companies are working in this cutting edge space of IVDs. So let's get into this a little deeper. So what's an IVD? Well, IVD is a system, so it's not one thing. So it's basically a combination of an instrument, reagents, meaning chemistry, there is software, calibrators, controls, etc., etc. So basically, you have a bunch of different things that come together, and then you take a patient sample, and then you test it. You get the result. You can transmit that data to the lab or the hospital network, and then of course you have to communicate to the physician. The physician then would talk to the patient and diagnose and provide the right treatment regimen, right? So this is the process. So IVD is a system, and then depending on your interest, you could go on and work on instruments or chemistry or software or whatever the case might be. But it's really a holistic approach to try and diagnose what the disease state is. So how does this have to do anything with St. Cloud State? Well, we offer, as a learning institution, St. Cloud offers 2 courses in IVDs. These are graduate level programs. So one is a basic IVD course, and then there is an advanced IVD course. In fact, the basic IVD course is going on as we speak. And in the month of June this year, we are offering a course on advanced IVDs. And so Amy Fowler teaches the basic IVD course, and myself and Sumesh, who is the head of quality for a molecular diagnostics company out in California, both of us are tag teaming to teach this advanced IVD course. So these are the kinds of things that we cover. So in the basic IVD course, these are the fundamentals. What are the different common terms? There is something called PCR, polymerase chain reaction, which really is the foundation of all the molecular diagnostic tests. So we talk about PCR, we talk about submissions, labeling, and all these new regulations, requirements, and things like that you have to comply with to operate in this space. And then in the advanced IVD course, we get deeper. We want to understand how to use the results to clinically diagnose different disease states. Talk about how to assess how good the test is, how many false positives, how many false negatives, et cetera, right? So we get into a little more depth about these types of tests. And then lastly, we talk about this new regulatory pathway that FDA has been using for all these vaccines and diagnostic tests, called as the Emergency Use Authorization, EUA, and you may have heard of it in the media. But we talk about what this EUA process is, and how do you submit a EUA, how do you get approval for it, etc. So we get into a lot more depth in the advanced IVD course. And then so basically, this is it. So in summary, I would say first thing is accurate diagnostics is critical to patient care. So if you want to get into the field of medicine, you want to get into the field of diagnostics, that the work that you do is critical, for patient management and for patient care. And there's a lot of exciting, groundbreaking research that's going on. Use of artificial intelligence, fuzzy logic, etc. In these types of technologies that's happening. And it really is an exciting world for STEM majors. So I would highly encourage, any STEM students, any STEM professionals, teachers, etc., to get deeper into this world of IVDs. So I'll end here. And if you need any additional information, we have at St. Cloud State, we have a mailbox, medtech@stcloudstate.edu, and be happy to help you, with your learning and any other interest that you may have in the space. So thank you.